Metro Louisville is made up of 26 districts. This podcast gives you a chance to connect with your council member and learn about what's going down in your district. Welcome, everyone, to District Download. I'm Katrina Helmer. Joining me for this episode, I have Councilwoman Cassie Chambers Armstrong. Cassie, welcome to the episode again, to the podcast again.
Thanks for having me back. It's good to be here.
I'm excited about this topic because I know it's something you and I had talked about before. I know it's something you're really passionate about. But when it boils down to it, it might be something that people don't think of as a problem, but is a problem. So with that wonderfully vague teaser, I want to toss it over to you to let you announce what we're going to be talking about today.
Yeah, absolutely. So we're here today to talk about the problems of children being exposed to lead in the city of Louisville and the way that that causes permanent, lifelong issues for kids and for families and really for our entire city. And so I'm really excited to be joined by two folks that know a whole lot about lead and its impacts. First, we have Dr. Brian Gwynn, who is an assistant professor of epidemiology and the director of the MPH program at the University of Louisville, and really our city's leading lead expert and a lead researcher. Dr. Gwynn, thanks for being here.
My pleasure. Thanks for having me.
And then we are also joined by Megan Metcalf, who, in addition to being the District 8 legislative assistant, is an attorney who actually has represented lead-poisoned families in the past, children who have been exposed to lead, and has a lot of experience looking at the policy interventions and knowing sort of the nuts and bolts of this policy issue. So, Megan, thanks for joining us.
Thank you for inviting me, Cassie.
I'm really excited for this conversation because I think Katrina was right. It is something that a lot of people think that we have already dealt with. They know that we stopped putting lead in gasoline. They know that we don't put lead in paint anymore. And so they think, hey, we've dealt with this lead issue. This is something that we as a society have solved. And the truth is that we haven't really. And in fact, we've kind of ignored it and forgotten about it over a period of time. And so I'd like to start. Dr. Gwynn, tell us a little bit about your research and what it's shown about the problem of lead and how that impacts kids in the city of Louisville.
Yeah, it's a tremendous issue. And like you said, just because we've taken lead out of gasoline and we've removed lead from paint, the remnant lead from those uses is still around. In fact, there are millions of tons of lead waste still in this community, still around the United States, I should say. And so when I started thinking about lead research, I reached out to the Louisville Metro Department of Public Health and Wellness. And I said, I'd really like to look at your blood lead data set and evaluate the magnitude of this issue because it still seems like it's a big issue. But what are the actual numbers? And so I worked with the state of Kentucky, I worked with Louisville Metro, and I put together a blood lead data set that goes back to December of 2005 all the way through June of 2021. And that resulted in over 111,000 blood lead tests. When we remove duplicate tests, we end up with 74,000 individual unique children. And what we found out of those 74,000 unique children, just since the very end of 2005, some 9,800 children were found to be lead poisoned right here in Jefferson County. And this is really sad. This is something that should not be happening. And it not only happens in Jefferson County, but it particularly impacts a certain segment of society. So of those children, I had addresses to about 44,000 home addresses for where those children lived. And I spatially mapped those. And what I found was applying some spatial statistics, children that live in West Louisville, say from the Shawnee neighborhood over to Smoketown and from Portland down to Shively. If you think about putting a circle around those neighborhoods, children that grow up in that area are more than 9 times more likely to be lead poisoned. That's not 9%, right? That is a tremendous increase in risk for lead poisoning. As an epidemiologist, we get excited if we get a relative risk of 3. We're talking about a relative risk of greater than 9. So if you live anywhere else in the county, you don't have that risk. So why is it occurring in West Louisville? And really it comes down to the use of lead throughout the 20th century and remnant lead being left behind in the soil and the homes. So it's still a tremendous issue in the county. Every year we look at about 600 kids that are lead poisoned in our community.
So talk to us a little bit, for people who might not understand what it means when you say there's a child with an elevated blood lead test. Maybe people aren't as familiar, maybe they don't know why that's such a severe issue. But you just said 9,800 kids since 2005 in our community that have had elevated blood lead tests. Talk to us a little bit. Why is that a problem? What does lead do in our body? Why is it something that exposure to kids is so dangerous?
Great question. I was a nurse for a long time at Baptist East, and we would look at blood tests to evaluate people's health. We'd look at things like a basic metabolic panel or a comprehensive metabolic panel, and we look for elements in the body, things like sodium, potassium, calcium, things that our body uses and needs to be healthy. What you won't find on that test is lead, and that's because there's no biological function of lead in the body. In fact, the only outcome that we have with lead when we're exposed is a negative outcome. It's not even inert. When it gets in our body, it actually hurts us. So it's a tremendous issue because lead mimics calcium. I'm speaking very generally here. The actual toxicokinetics is very complex, but when you ingest lead as a child, right, that lead looks like calcium to the body, and it can cross the blood-brain barrier. And when it gets in the brain, it can disrupt the calcium kinetics of the neurons. Those are the brain cells. And when it does that, it can cause neuronal cell death. And so you might say, well, what does the literature show about adult brain volume or the density of neurons in adult brains for children that were exposed earlier in life? And what they found is kids that are exposed to lead early in life have reduced adult brain size, specifically of the prefrontal cortex. This is the last part of the brain to develop. This is part of the brain that brings about our executive functions, things that help us live our lives, things that bring about our intelligence, our ability to plan, to communicate, to organize. And so it's not just a metric on a table. Oh, there's so many kids that are lead poisoned. What we're talking about is a geochemical brain injury that has a permanent negative impact on children's lives. And not just that, it can impact the reproductive system. It can impact the kidneys. That can lead to hypertension. That can lead to heart disease. And generally speaking, when you look at the literature, time and again it shows early life lead exposure is associated with all-cause mortality and cardiovascular mortality later in life, as well as things like reduced intelligence, problems with learning, ADHD, and a whole host of behavioral issues. So I don't think about lead as a metric or a statistic on a table. I think about it as children being permanently injured in our community through no fault of their own. They're just growing up. You put them down on the floor to play. Kids put their hands in their mouth. That's the way they learn to think, right? It's part of It's part of normal neurocognitive development. And so if you live in a lead-contaminated environment and you put your hands in your mouth, you're incidentally ingesting lead. And then all those processes I just talked about occur. And so little children, 1, 2, 3 years of age, are being poisoned by their environment through no fault of their own, and it's having devastating consequences on their health and on the community.
Yeah, so I want to just reiterate some of the things that you said, and if I misstate anything, please let me know. But it sounds like the way that this works is you have something like, say, lead paint in a house, and that lead paint starts to flake, and it breaks down into dust, maybe dust on the inside, maybe dust in the soil. And that kids, as they're exploring, they're putting their hands in their mouth, they're touching dust, and they end up getting that lead into their bodies. Could you talk to us a little bit, like, what is the safe amount of lead for a child to be around? Because I know I've heard you talk about how even just a tiny, tiny bit of lead can have this permanent impact and cause this brain damage for kids.
That's another good question. Right now, we say the safe amount of lead, the reference level is 3.5 micrograms per deciliter in the blood. That's down from 5. That's something that occurred recently in the last year or two from the CDC. However, at the same time, the CDC tells us that there is actually no known safe level of lead in the body. In fact, when you draw blood out of your arm or out of your child's arm, the blood lead level should be 0. So we don't want kids exposed to any lead. Really small amounts of lead can cause harm. In fact, I've said this before, if you take a sweet and low packet and it was just lead dust and you spread it out evenly over a football field in an NFL stadium, that lead dust would more than double the amount of lead that should be found in a child's home with the current EPA standards. So it's not something that you can just say, well, parents just need to vacuum and mop up. We're talking about microscopic amounts of lead that you can't discern with any, with your eyes or your mouth or your nose. You can't taste it. It's really small amounts of lead that can raise the serum blood lead level sufficiently to bring about this cell death in the brain or kidney disease or hypertension. So no amount of lead is safe. All environmental lead should be considered a hazard, in my opinion.
And that's one of the things, what you just said about sort of lead being invisible is one of the things that I think is most scary about it. In addition to the lead itself being scary because it's these very small amounts, it's not something that we know how to look for. We can't actually see it in our environment a lot of the times. Also, the impacts on kids can be a little more invisible from my understanding because it doesn't always look like a child having some catastrophic medical event. It looks like this slow but permanent impact to their brain and their higher cognitive function that can impact their educational attainment, their sort of ability to control themselves. I've seen some studies that it's linked to educational outcomes and to ADHD and to all kinds of behavioral issues. And so it's something you might not ever know that is why that child has difficulty learning or difficulty concentrating, because it can be really hard to actually make that connection. Did I say that right? Is it sort of difficult sometimes to know that lead has impacted a kid unless you just happen to look at their blood lead at that particular moment in time?
Well, you're absolutely right. The majority of lead-poisoned kids in the United States don't manifest any overt clinical symptoms. It's usually very low levels of lead in the blood. However, those low levels of lead in the blood usually are not addressed, and so kids are exposed for long periods of time at low levels. And so that lead exposure might manifest later in life, first and second grade, third grade. Oh, my child has behavioral issues, or my child has a learning disability, or they have ADHD, or they're just not getting along, or they're not remembering what they should remember. So the impacts of lead often manifest later in life with some sort of learning issue or behavioral issue. It's not something you go to the doctor and they can look at and say, oh, that child has lead poisoning, right? The impact might be something we see 5 or 10 years down the road. And often it's not something that kids age out of. That negative insult on the brain, that's something that will stay with that child all the way through their life. Once you lose those neurons, once your brain stops developing as it should have, right? That's a permanent issue for that person. That's very troubling to think about.
Yeah, it's incredibly scary when you say 10,000 children in our community since 2005 have tested positive for elevated blood lead. And then you think about all the kids that we aren't testing for blood lead, because the way our insurance schemes for most people are set up is they will pay for one blood lead test for a kid between 12 and 18 months old. But if a child moves into a house at the age of 2, or when they're a tiny baby and they're exposed to lead, and that's when the lead exposure happens, we might not ever know it. And so that 10,000 number is probably an undercount. Is that fair to say? Absolutely.
It's probably many times higher than that. That's just who we've documented. A lot of times doctors don't report that blood lead level, especially if it's below 3.5. In the future, they may say, well, the new reference level is 2.5. But now we've lost that data. So I'm confident the actual amount of blood poisoned kids in this community is very, very high. It's probably something like 30% of kids, maybe 35% of kids that live in West Louisville have a dangerous amount of lead in their blood early in life.
I'll be honest, that hearing you say that makes me just feel nauseous. It makes me feel just kids are the future of our city, especially kids that come from neighborhoods that don't have as many resources as other parts of our city. Having this disproportionate impact is just really troubling to me as a parent of 2 kids around this age. So I want to pivot a little bit to talk about some of the social costs associated with lead. The Louisville Center for Health Equity has put out a really great policy brief that's available on their website that talks about some of the particular costs outside of the medical costs, what this might be costing our community. And by their estimate, we know that they suggest that lead poisoning costs $50,000 per kid in terms of lost opportunities, in terms of decreased educational attainment, in terms of all of the social costs associated with it. And Megan, I'd like to go to you to talk a little bit about what these social costs look like, because I know prior to joining Metro Council as a legislative assistant, you worked as an attorney and had the ability to represent kids who had been lead poisoned and families going through this. And could you just talk to us a little bit about your experiences and some of the things you saw?
Yeah, so before I joined Metro Council as your legislative assistant, I was the legal director of Doctors and Lawyers for Kids. It's a medical legal partnership. So I worked in pediatric clinics, providing legal services to families. I was charged with assisting families with anything that is a legal issue that could have a health impact. And I don't think that we could really find anything that is more closely tied between the legal needs of a family and the health outcomes of their children than a few different families whose children had tested positive for lead and elevated blood lead levels. They were always families who were living in rental housing. There is funding that provides case management for families if their children have severely elevated blood lead levels, even though we know that, as Dr. Gwynn said, there is no safe amount of lead in their blood. For the children who have the highest levels of blood lead levels, they will get some case management from public health to try to find where the source of the lead is to remove the children from the source. The problem is that for families who live in rental housing, they are very limited about what they can, require the property owner to do. Oftentimes, what I was helping families with was just getting them out of that environment, helping them to legally break their lease. But we're also talking about families who often were low income. They didn't have a lot of resources that they could just uproot and move to a new house that they could pay for a security deposit and for the cost of moving. So they were having those other social impacts too of taking their kids out of their neighborhood, away from their friends and family. They often had other problems that were going on in their life. So I represented a grandmother who was caring for her grandchild. So she already had some custody issues that she had to work with as well. And what she noticed when she brought the child into their home, that their behavior really just became almost unmanageable. There was a lot of aggression. There was a lot of hyperactivity. And it was a lot for her to manage, being a grandparent as well, not having necessarily the energy that parents often have to chase around their kids. But she also said that it was like seeing the light go out of her grandchild's eyes, because this child just had their blood level was off the charts, awful. And when I would communicate with the property owner, they were really intransigent. And so the only option was to get the family out of that house. The problem is that there was nothing that could prohibit that property owner from immediately re-renting that house to another family, and putting another kid in that environment. And since we've been working with the Department of Public Health and Wellness, they have addresses where dozens of kids have been exposed. The family health centers that I work with in Portland, they know the addresses. And if they see a kid coming in for a well child check and they have a certain address, they know immediately we have to get this kid a blood lead test, because we know that there have been other children, other families who have been through this. And it's really tragic that we are letting this car crash happen again and again and again to our kids.
Yeah, there are a couple of things that I want to pick up on in that. I do want to ask Dr. Gwynn, because I know some of your research looked at sort of mapping rental properties with elevated blood lead levels. And could you tell us a little bit about what your research found there? I know some of it was very similar to what Megan just said.
Yeah, it appears that children living excuse me. It appears that children living in rental properties have something like a 50% increased risk for being lead poisoned. And not only that, we find that certain rental properties produce multiple lead poisoned children, or every child in a family is lead poisoned, or a kid is repeatedly exposed to lead at dangerous levels for 4 and 5 years. It'd be one thing if we saw a blood lead level of 20, and then it comes down in a curved linear fashion over a 2-year period. But what we're seeing is kids have a blood lead level at 6, and then it goes to 20, and then it goes to 10, and then it goes to 60, and 40, and 30, and 20, and it does this shark tooth down the line for 5 years, and then they just fall off surveillance. But that tells us that those kids are being continually exposed from a common source within that rental property. So every kid in a family, multiple kids over time, or just one kid that's repeated many times, or a combination of any of those three, that's something that's commonly seen in rental properties in Louisville.
And I would just like to point out, there is no cure. The cure is prevention, is getting the kid removed from the source and preventing further damage to them. There is not a pill that we can give a child once we have diagnosed them with blood lead poisoning.
And I think, and that's where I want to go next, is this idea that there is no cure. And so for these 10,000 children that we know of, because Megan, what was powerful, I think, about the story you were telling about the child who was acting aggressively and having behavioral issues is you might not know to test that child for elevated blood lead. When somebody did test that child for elevated blood lead, it showed that that was likely the cause, the medical cause of a lot of these behavioral issues, and is probably going to be something that will impact the way that child's brain works for the rest of their life. But if you didn't know to look for that, if you didn't take that child to that well check, or if they weren't in that small window that insurance would pay for that blood test, we would never know.
That's right. I mean, it also impacts the way that they have access to other tools like special education, or we call it here exceptional child education and JCPS. There's case law that says that that lead poisoning can be considered a disability that makes you eligible for an individualized education plan and additional services. But you have to have proof of that diagnosis that really helps to augment whatever is going on in the classroom, the behavior and the academic performance. If you don't have that lead test, then what you see may not rise to the level of a separate diagnosis like ADHD or oppositional defiant disorder. And so those children might be shut out of those extra educational opportunities that they need to help them succeed because of what has happened in their past.
So I imagine that there are a lot of people listening to this episode that are having a similar reaction to what I had the first time I heard about this problem, which is, this is an outrage. How is this not illegal? How have we not solved this? How is this still happening? And what can we do about it? And so, Megan, I want to go to you because I know that you've done a lot of research about like what other cities have done and what the policy options are. And I will say we are working on a solution in Metro Council informed by a lot of this. But tell us, what are some of the policy options that other cities have done, and what kinds of outcomes have we seen from that?
Well, knowledge really is the first thing that we have seen cities want to address. So they start by having some sort of assessment of the rental housing. Rochester, New York was one of the first and has really been a leader in this. Almost 2 decades ago, they passed their own ordinance that had a city staff members that would screen rental housing for lead hazards. Other municipalities like New York City, Philadelphia, they've also passed their own ordinances that ensure that there's someone checking on these rental properties, that there's some sort of surveillance, in some manner to assess what the lead hazards are in the homes that we're putting these children in, and then requires that property owners take responsibility for their properties. If their properties are making children sick, that they have a way to require them to fix it in some way, either to completely get rid of the lead, which obviously is always the best option, but it can be like prohibitively expensive, or at least to find a way to control the lead so it's no longer a hazard to the people living in it. So there are special additives that you can get to add to paint over peeling and chipping paint. And these other municipalities have had great success in bringing down the number of children that were exposed to lead after these ordinances were passed.
And so just to recap, it sounds like sort of step one of what a lot of cities do is figure out where the lead hazards are, make people actually go and affirmatively look for the lead hazards, and then when you find them, require folks to either remove them or to do something to keep the lead from being a risk. Did I say that correctly?
That's exactly it.
And you said that those cities have seen successes. Is that reduced elevated blood lead levels for kids, or tell us a little bit more about what that looks like?
Exactly. They have seen over the course of analyzing both before and after those ordinances have gone into effect that the number of children who are exposed to lead in their blood lead level has decreased.
And so the one thing, I think a lot of times people, anytime you're talking about a policy that might add costs somewhere, people are like, oh, well, is it worth it? And so I do just want to reiterate that at $50,000 per lead poisoned child that we know about, times 9,800 kids, it suggests that the city of Louisville is currently spending $491 million in social costs for the lead poisoned kids, again, that we know about, and Dr. Gwynn suggested that that's probably a vast undercount. Dr. Gwynn, I do want to ask you a little bit from sort of as an expert in this, as a researcher, in terms of like best practices of what we should be doing or what we could be doing to get lead out of our communities. Could you talk a little bit about the importance of proactive approaches and sort of how that might fit into a best practice for reducing lead exposure for kids?
Sure, we absolutely have to be proactive. Once we find a lead poisoned child, as it was just stated, the issue has already occurred. It's kind of too late. We can remove the child from that environment, we can clean it up, but that negative insult on the body has already occurred and will continue to occur. That's how lead operates in the body. So prevention is key. So we want to engage in primary prevention strategies. We want to prevent the lead poisoning from ever occurring. And so we want to test our kids early in life, 1, 2, 3, 4 years of age. We want to get serial blood lead testing to make sure they're safe. And we also want to look at our environment. Is there lead paint in the home? Is there lead in the house dust? Is there lead in the topsoil? We don't think about soil necessarily, but soil is a primary constituent of house dust. And because of the way lead exhausted from tailpipes during the lead gas era, entire communities in our town are covered in lead-contaminated topsoil. So you cut the grass, right? You garden. You bring some of that topsoil in with you on your shoes. That becomes part of the house dust. That topsoil has lead in it. Now you have lead-contaminated house dust. So you want to know, is there lead in my topsoil? Is there lead in my garden? Is there lead in the window wells of my house, in the painted surfaces of my house? And if there is, you want to take steps to remediate that or abate that. You want to cover it up or you want to completely remove it. Primary prevention is key. Reacting to it after the fact, we might call that secondary prevention, that's too late. But that's what we've been doing for the last several decades in our communities. We're just reacting after the fact.
We are out of time for today. I do think what has come through for me in this conversation and all of the conversations I've had is that this is a huge and invisible problem that we have ignored for a long time, and we have to do something about it. We cannot continue to let children in the city of Louisville face these impacts that are going to cause them problems for the rest of their lives, cause our city problems for the rest, for the future, and not do anything about it, especially when we think about children being our greatest resource, and quite frankly, a population that we owe an increased duty towards. We should all be invested in making sure that our kids have a good start in life, and certainly that we aren't doing anything as a society or turning a blind eye to a problem that is going to have lifelong consequences. So I want to thank you both for being here today and joining in the conversation, and invite the public to stay tuned and stay engaged in this conversation because it's something I hope that we can move forward as a city and we can take some steps towards. And I appreciate both of your all's involvement in this and your help. Thank you all.
Thank you.
Thank you very much.
Thank you all for being here. And I think someone said at one point, knowing is the first step. So we've kind of addressed at this point what the invisible problem is. So now anyone that's listening to this, you know that there's a problem. So there's also a piece of responsibility there. Councilwoman, if someone's learning about this and says, oh my gosh, what can I do? Is there anything I can do? Or what's the next steps? For anyone listening, what is your suggestion?
I would say they can reach out to my office, get in touch, cassie.armstrong@louisvilleky.gov. We'd be happy to talk to you about some of the policy efforts that we're thinking about. If someone is concerned, oh my goodness, I think I might have lead in my house, there are professional lead inspectors that can come and tell you if you have lead in your home. There are also some sort of lower level things. So after I started learning about lead, I actually went online and ordered some lead swabs, which you can go and you can actually wipe on window seals, on peeling, chipping paint. Just take a dust sample, and then you're able in your house, it'll turn pink in the presence of lead. So there are some very easy consumer tools that If you're like, oh my goodness, I live in a house that was built before lead was banned in paint, or I don't know if there is lead in my topsoil, there are some easy ways that you can become an advocate for yourself and gain more information.
Well, thank you so much, everyone. And I hope that this does kind of trigger a bigger conversation for everyone outside of this.